So you deal with chronic pain, you feel uncoordinated, and you don't know what to do. Let me teach you how to feel good. I do not care if you look good. I simply care if you feel good. That is my mission. It is so that when anybody does whatever movement they do, they feel comfortable. My name is Samantha. I am a Feldenkrais practitioner who would like to teach you a Feldenkrais lesson that will help you organize your pelvis with the rest of the movements of your spine. The spine. There's a lot of movement possibility in our spine. And if we gain access to sensing that movement possibility, we will naturally have more freedom within movement, because once you sense something, you learn it. And nobody can take that away from you. So once you've learned to be a better mover, it's yours. It's yours. And then you realize that you have a lot more power in the way your body feels on a day-to-day than you realize. I promise you. And step number one, when you're learning a movement, is to set yourself up in the most comfortable way. That way you can focus on the movement and not the discomfort that you're in. And that actually leads me to my next point. When you are doing my Feldenkrais lessons, whenever you feel uncomfortable, don't work through it. Stop the movement, lay down onto your back, and take a rest. Another thing that you can do if you're feeling uncomfortable is you can just lay down in your most comfortable position. Listen to the words that I'm saying. Just imagine it in your head, because movement begins in your mind. So please prioritize your comfort. Make sure you have enough support under your head that you are comfortable to lay down on your side. Let's lay down onto our back to begin. So as you lay here, start to observe what parts of you feel heaviest against the floor. And then start to notice the parts of you that feel lifted away from the floor. Then bring to your attention your pelvis. Is your pelvis weighted more on one side? Do you feel that one buttock is heavier compared to the other? Do you feel that your pelvis has more weight down the pelvis towards your feet, or up the pelvis towards your head? And whatever it is that you feel with the way your weight is resting on the floor gives you information as to what direction you are laying your pelvis in, which is also going to give you some information as to the shape of your lower back. So now take a moment to bring your attention to your lower spine and notice if there is any space between your lower back and the floor. And if you were to divide your lower back in half at the area of your spine, do you feel that the right side or the left side of your lower back is more lifted away from the floor? And then once you've gathered that information, bring your attention up yourself. We're going to go up towards the ribs and just notice the way you lay your ribs on the floor. In fact, what is the lowest rib you feel connected to the floor? And what is the highest rib you feel connected to the floor? And now when you're ready, lay on either side. Once you are laying on your side, you're going to stack your knees one on top of another. Your bottom arm, the arm that's laying on the floor, you can lay out straight in front of you. You can also bend it. Your top arm, you can have the hand standing on the floor in front of you with your elbow bent, or you can lay your arm over your side. I suggest trying both and see what you find most comfortable. Once you have settled into your favorite position, start moving your top shoulder a little bit forward to the wall in front of you, and then come back to where you started. It's nice to close your eyes in this moment and just get a feel for the simplicity of this motion. It's easy, it's small, and as you're moving your shoulder forward, you can start to be curious about the connection of your collarbone connected to your shoulder and to your breastbone. So when your shoulder moves forward, do you have any sense of how your collarbone moves. You could take your bottom arm and place it near your collarbone. Place your bottom hand near your collarbone and continue doing that motion. And it might give you a different picture of what's going on when your shoulder moves forward. And then take a rest. Next, you're going to bring your top leg and top hip into your awareness, and you're going to slide your top knee slightly forward, and then you're going to come back to where you started. So as you are doing this, your top knee will slide maybe an inch or two beyond your bottom knee, and then you'll come back, which is a movement that is coming from your pelvis. So feel that your top hip moves a little bit forward as well. And now I encourage you to go about this movement as slowly as possible with your eyes closed, with an attention on your spine. And ask yourself, as you start to take your knee forward, can you feel the sequence to which your spine rotates? Perhaps you need to just focus on whatever movement it is you can feel in your spine. Sometimes it's hard to be specific, but whatever movement you can feel in your spine, feel it while you're doing this knee forward movement. And then take your attention a little bit up or down your spine, but close to the main place of your spine that was easy for you to feel. And please don't force the movement. Just feel what you can feel. Okay, now you're going to just leave that alone and bring your attention to your shoulder. And now do a motion of moving your shoulder a little bit backwards. Whatever feels easy, something that doesn't make you breathe differently. Your breathing should feel relaxed. You're not having to muscle through your breathing to do this. Keep it simple and do it in a way that's soothing to you. You are moving yourself. So move yourself in a pleasant way, in a way that you enjoy. And again, you can place your bottom hand near your collarbone and your shoulder. And as you move the shoulder backwards, just simply feel what happens to your collarbone as you move your shoulder backwards. Now let's try something. The next time you move your shoulder backwards, could you invite your head into a gentle roll so that your nose slightly turns towards the ceiling, or maybe it just goes up the wall a bit. And then take your shoulder forward, and as you take your shoulder forward, nudge your nose towards the towel that you're laying on or towards the floor. So now you start to do this movement of your shoulder and your head rolling in the same direction. Have your bottom arm placed wherever it feels nice for you. And as you do this, pay attention to your breathing. When do you find you're exhaling? And when do you find you're inhaling? And as you do this, do you feel any movement in your spine, or can you imagine that your spine is moving at all? And now we're going to differentiate things a little bit. So that means instead of everything rolling forward and backwards at the same time, one piece of you will go forward and the other piece will go backwards. So let's start that idea with the shoulder and the head. So what you'll be doing is, as your shoulder rolls forward, you will slightly turn your head towards the ceiling. And then you'll come back to where you started, take a pause, and as your shoulder goes backwards, your head will roll slightly towards the floor. So let's do that together. As your shoulder moves forward, slightly roll your head towards the ceiling. And as your shoulder goes backwards, slightly roll your head towards the floor. As your shoulder moves forward, slightly roll your head towards the ceiling. As your shoulder moves backward, slightly roll your head towards the floor. And as you continue to do this, do you find that you hold your pelvis still? Do you find that you hold your breath? Sometimes we just need to become aware of something to stop doing it. And now let's try to do something different with that. We're going to put an intention. Make this motion of your hip and your head moving together seamless, smooth, and easy. So as your hip goes backwards, you slightly turn your head towards the ceiling and you come back to where you started. Pay attention to your breathing. Make sure you're not holding it. Your facial muscles are relaxed. Keep everything easy. And now when your hip moves forward, roll your head slightly towards the floor. Again, don't worry about your shoulder right now. As you roll your hip forward, your head rolls towards the floor and you come back. Notice what happens to your breastbone as you do this. What happens to your ribs. Now that you've practiced that a few times, let's add in a subtle motion of the shoulder. So you're going to continue doing the same motion between your hip and your head, but your shoulder will now go in a slightly different way. So when your head and your hip roll forward, your shoulder will slightly roll backwards. As your head and your hip roll forward, your shoulder will roll backwards. Come back to where you started. I'm going to repeat that a few times so that you can continue hearing it as you do it. Your hip rolls forward with your head and your shoulder rolls backwards. Come back to where you started. Your hip rolls forward with your head as your shoulder goes backwards. And you come back to where you started. And now, try this the other way. Your hip and your head roll backwards as your shoulder rolls forward. Come back to where you started. Your hip and your shoulder roll backwards as your shoulder rolls forward. And you do it so small that even though you've got these moving parts going in opposite directions, it's easy. You are teaching yourself how to do a movement in a differentiated way, in an easy way. Okay, leave that all alone. Take a moment to rest. And now let's revisit the motion of the knee, shoulder, and head rolling forward and backwards together. This is that motion that we did in the beginning. And I'm curious to know if it feels different than the way you did it before. Does it feel a little bit easier? Okay, now lay onto your back and take a rest. So now that you've done one side of your body, notice if one side of your body feels like it's connecting differently to the floor. Maybe there's a change in the whole body. Maybe you need to do the other side before you feel that change. It's a different experience for all of us, but give yourself an opportunity to just rest and feel the way you're connecting to the floor now. And now roll your head gently side to side. And you might notice that it's different from one side compared to the other. So do the other side of your body. I didn't say right and left so that you could just simply rewind and do this on your other side. Let me know what you think about this in the comments. And please let me know what are some things that you're dealing with that you would like me to give a lesson on. Bye!